Basically, today I was talking about the HPV vaccination in the world and the vaccination hesitancy, which is a problem that nowadays it's becoming a real worldwide problem because it's not only affecting HPV vaccination but all of the vaccines. So the WHO has pointed out that vaccination hesitancy is one global threat to the health of humankind. So I was talking today about that situation of HPV vaccination around the world, in Latin America, and obviously again in Colombia. That unfortunately, after having a very nice program nationwide that was paid by the government for some crazy event that happened many years ago in a little town, the vaccination rate dropped to levels of, let's say, Africa. So we are in the process with the Columbian League Against Cancer in trying to change the history, reverse that situation, but it has taken us a little bit more time and effort of what we thought. We are working hard with the American Cancer Society in that project, and we are deeply involved with all our heart in this program, and certainly I'm convinced that we are going to reverse the situation, and finally we will eliminate cervical cancer from our country. Before that event that I call the nightmare event, the vaccination rate was above 95%. Colombia was really one of the countries that was pointed out as an example to follow. We were similar to Australia. But from that point of the event of Carmen de Bolivar, vaccination rate dropped to less than 10%. And despite the effort that we are doing, countrywide, we have been able to increase it to 26% of vaccination rate, which is obviously ridiculously low. But in the area in which I'm working, that is in a province frontier with Venezuela, it's called Arauca. Just in one year that we have been going and trying to convince the authorities, the parents, the mothers, the adolescents, we increased from 4% to more than 40% in just 1 year. And now this year we are implementing the strategy to recover the trust, the confidence of the community in the vaccine. It's given for free, and so we don't have an excuse not to improve that. I mean, all of these bad stories about the vaccination and the problem with the vaccine and all of this nonsense that was built out around this episode, we have to tell the community, the adolescents, the parents, the teachers, listen, this is the evidence. The HPV vaccination is safe, is efficacious to prevent one of the cancers that is number 2 in incidence and mortality in countries like Colombia. So we don't have an excuse not to reverse this situation, and we must and will do it. What you're mentioning is correct, but I think that not only those issues. Colombia is one country, but you can find in that country at least 5 or 6 different regions that by themselves are a different country. So the way you talk to people from the Caribbean coast is different to the way you need to talk to the people from the Pacific coast, and different to the people that live in the plains near Venezuela, and different to the people that live in the hills, Bogota and all of this area, what we call Andean regions. So we need to know that, and one of the things that I discovered when I went to Arauca was that one of the mistakes that we usually do is that we decide things in Bogota, and we with a good intention, but we forget that people are the ones that they need to give the instruction on how to go to them and how to approach them. And we used to dictate things from Bogota to go there. We went there, we went to talk to the community, and they told us how were they willing to hear the message of the safety of the vaccine? So after hearing the community, we were able to construct a strategy, and that's where the American Cancer Society and the Johns Hopkins University helped us a lot with the process, funny thing. But in fact, it's a way to analyze the situation, construct the solution with the community, so the answer comes from the community up and not the other way around. So I'm convinced that we're going to be successful. We're going to launch this program the following week, and I'm really excited, really. I think that HPV vaccination is an ethical and a moral issue for all doctors in the world. Cervical cancer that kills almost 1/4 women around the world is a disease that nowadays is preventable and curable. So we don't have an excuse to see how a woman in the age of 20 to 45, age in which usually they are mothers, if a mother of that age dies, we don't have the money to replace a mother. A mother is unreplaceable. So all of the efforts that we can do to prevent the premature death of a woman is worthwhile doing. And I was talking to people from Peru and hearing the situation in Chile and all of Latin America. And we are very much similar. The situation is quite similar in all of these countries. It's interesting to talk, to see, and to share not only the tragedies, but also the dreams that we all have to try to improve the situation of the health in our communities, in our countries. I think all of the physicians that I was able to meet today here in Lima, we were sort of like a team, that we were united by that sentiment of, hey guys, we need to do something in our countries. And the spirit was that, yeah, we'll do it.